Hello, my name is Mariah Petersen, and I am in Nursing 737, and I will be presenting on hypertension. So, some background and prevalence regarding hypertension. It's estimated that 119 million adults in the United States have at least stage 1 of hypertension. Hypertension costs the U.S. at least $131 billion each year. And only 1 out of every 4 Americans have their hypertension under control, which then correlates to only 27 million out of the 119.9 million adults diagnosed with hypertension. So quite a significant amount of people are not controlling their hypertension. At-risk populations include African Americans, Asians, and Hispanic populations. The risks of having hypertension and not keeping it under control include stroke, coronary artery disease, and heart failure. So the cause and pathophysiology behind it, first, it's good to define what it actually is. So it's the amount of blood pushing against the walls of the arteries. If the pressure is too high over time, it can damage the heart and the vessels. The pathophysiology, according to UpToDate, was slightly vague, but there's multiple components involved with the process of hypertension, and those include the nervous system, the renin-angiotensin system, and the kidneys, as they all control volume and response. Causes include family history, which is not modifiable, physical inactivity, which can be changed, a poor diet that is also high in salt, poor sleep or sleep apnea, oral contraceptives, NSAIDs, antidepressants, and corticosteroid use. So oftentimes the patients won't present with obvious clinical symptoms unless the blood pressure is extremely high, but some complaints that may be observed by the patient are headache, shortness of breath, eye pressure, and nosebleeds. So the clinical definition and criteria by the American Heart Association includes stage 1, which is a systolic blood pressure of 130/80, and stage 2, which is a systolic blood pressure of 140/90. Now, in order for these to be essentially diagnosed, the patient must have 2 blood pressure checks on 2 separate occasions, roughly within a week. Sometimes white coat syndrome can be involved, so the patient will be asked to take their blood pressure at home at the same time and to record those values, and then the patient can return to the clinic for a follow-up visit, possible diagnosis depending on if those levels are still elevated. So the treatment and management initially for stage 1 is an ACE inhibitor, calcium channel blocker, or thiazide diuretic. Also important to keep in mind non-pharm treatments for stage 1, which include exercise, a low sodium diet, education regarding smoking cessation. However, if the patient has stage 2, then you're probably going to need to use at least 2 different antihypertensive agents, and the most commonly ones used are an ACE with a calcium channel blocker. However, if there is edema on board or other comorbidities, then you might consider a thiazide diuretic. Another thing to keep in mind is if the patient has osteoporosis again, then you would also want to consider a thiazide or chlorothiazide along with an ACE inhibitor, which might be a better choice for the patient. And then close follow-up is needed to ensure that the blood pressure is coming down, it's not dropping too drastically, they're not getting dizzy, because you also want to be aware, if a patient is older and say they're on a blood thinner and then you drop their blood pressure, that can cause a lot of harm if you're not careful with that. And then obviously you want them to come back at least between 2 to 4 weeks, close monitoring, close follow-up, with preferably within a 2-week time frame. So And then just keeping the Christian worldview in perspective, just treating patients in a kind and loving manner, and understanding that a diagnosis of hypertension can be hard, and that they're going to have to make some lifestyle changes probably, and so just meeting them where they're at and keeping that in mind. So that, thank you very much.